Hey everybody, this is Monson Steed and welcome to Health IQ. Now, we are going to increase the IQ of the health of everyone who hears this particular video segment of Health IQ. I'd like to welcome my dear brother, HBCU power thinker, true thought leader, dedicated physician, true mastermind of understanding the service delivery of medical services, that is, to our community, a studier, a very dedicated individual who has never left our community, understand the disparity, but also wants to offer intellectual, Black intellectual, that is, capacity for us to understand where we are, and so that you who don't want to end up with a droopy face understand that stroke is very real. And we want you to share this video with anybody that you know that has the propensity to have either high blood pressure, diabetes, or any other neurological disease that could lead to stroke. I have with me none other than true Fisk graduate, my dear brother, and of course, he studied everywhere, including Harvard, my dear brother, Dr. Richard Benson. How are you?
I'm doing well. Thank you, Mr. Steed. It's truly honored. I really love that welcome. I'm honored by the welcome, and even more honored to be on your show today. I'm really happy to be here and to talk to you and your audience.
It's very kind of you to say that, but here at Health IQ, I am amazed at how dedicated individuals like you take the time to start at Fisk and then know in advance that I want to, and obviously for those who didn't, Harvard was just a halo for those that don't understand, but Meharry is truly the place of being able to understand how and where Black doctors have been made for over a century. So just wanted to tap that in. I didn't want them to think that I didn't know where you had gone to medical college, but I really appreciate all that you do. And I'd like for us to really talk about the community and Black men in particular right now. What's happening? What should we know about stroke?
Wow. Yeah. No, that's a great question. Well, stroke is actually it's currently the fifth most common cause of death in the United States, and it's the number one cause of a disability among adults, and it disproportionately affects people of color. According to one study, the Northern Manhattan Stroke Study, which was funded by the NIH, and I had the pleasure of working on that study when I was in New York at Columbia, they found that stroke is 2 times more common in Blacks compared to whites, and it's 1.5 times more common in Hispanics compared to whites. And so there's a clear disparity with stroke. And one of the major modifiable risk factors for stroke is uncontrolled hypertension. And African Americans have the highest rate of uncontrolled hypertension in this country. And among all Americans with uncontrolled hypertension, African American men are the highest with uncontrolled hypertension.
All right, brothers and sisters, and those. The question I asked, if a person wants to live and they're having uncontrolled hypertension, what are 2 things that you think are the reason or rationale that Black men don't know that they have uncontrolled hypertension, and why is that the case?
Excellent question. I think it's because it's several fold. When we think of medical care in general, Black men and Blacks in general and in certain populations don't get quality healthcare all the time. There was a report, the Institute of Medicine report, that showed that some of the disparities in healthcare are related to healthcare related factors in terms of how people are treated in the system. And so that's there. Historically, there have been challenges that people have had with dealing with doctors and research. And I think all of that together, in addition to lack of what we call the social determinants of health, and maybe we can talk about that a little bit more later, such as lack of health insurance, lack of quality education, transportation, and all those factors put people at risk. And so some certain groups have so many competing needs where putting food on the table, getting work to pay your light bill or your gas, all of those things take priority over your health. And so there are a lot of people who just don't see health as a priority. They don't go to the doctor. They may go to the doctor and be prescribed medication, but aren't able to pay for it, or don't take it because they don't like the side effects and don't choose to go back and talk to their medical doctors again about it. So there are really a lot of layers to that in terms of why people don't follow up on their health. And a lot of people, again, this competing priorities, people don't see healthcare as a priority. And when you're young, a lot of people don't think about dying. But the one study that at the NINDS that we funded called the Sprint Mind study, we found that people that have uncontrolled high blood pressure in midlife, it increases your risk not only for a stroke and heart attack later in life, it also increases your risk for dementia later in life. So this is, again, by controlling your blood pressure, you could potentially decrease your chance of having cognitive impairment or dementia later in life. And so that's why we're targeting that specific middle age category of African-American men, that highest risk category, in order to try to get them to get their blood pressure under control.
That's my long pause for all those watching. This is a long pause. So I hope you're thinking about a loved one as you hear and see the truth, the facts, the research, which this is Black research by a Black trusted voice that is literally reaching out to everybody that could hear our voice to know, to share this video and to understand. But let's kind of talk about some numbers, because I think with Health IQ, we're wanting to raise the IQ of our community. So this target group of Black men, what's that age group so we can kind of begin to call them out?
Age group is from 28 to 45. That's that sort of pre-mid age group. If your blood pressure is uncontrolled, I often say that if you don't take care or think of your health in midlife, then you're at high risk later in life. But if you do everything you can right in that mid-age category, then you can pretty much sort of coast through the rest of your life, maintaining those healthy habits that you've developed. So between the ages of 28 to 45, if you exercise at least 30 minutes a day, 3 times a week, if you get 5 to 7 servings of fruits and vegetables a day, don't smoke, don't drink excessively, check your blood pressure, know the numbers. The normal blood pressure is less than 120 over 80. The study that I mentioned earlier, the Mind study, I'm sorry.
I said Jesus. I mean, at 120 is a hell of a number. 80 is a hell of a number. But anyhow, and they just reduced that. They used to talk about 130, and
Right.
now they've to reduce that. I was just calling that out as a number. But before you say anything, I'd like to say to our audience, it is important that we understand that part of what my brother, and obviously I'm calling my doctor my brother because I would trust him with my life. I want us to understand that you have to find someone to lean into. It is very important. It could be a nurse. It could be a nurse practitioner, but you need somebody on your team who will check your blood pressure. You need somebody that will give to you if you can't afford it. A church, ask a minister, a pastor, just to bless you with the blood pressure machine so that you can take your blood pressure each and every day. Or if you think every day is too much, at least twice a week. If you start at the beginning at the same time. I just wanted to share that, doctor, because it's all about community, taking care of each other. You might not know your number, but if you love somebody and they're in your life, their boyfriend, he's 28, and you don't know his blood pressure, you should. And if you don't know his blood pressure, you should. Did I say that right, Doc?
No, you're absolutely right, Mr. Steed. I think that's very important. A community is very important. You mentioned that Self blood pressure monitoring is very important as well. As you mentioned, if you don't know your numbers, you can't get it under control. The other piece that you mentioned that's important is it's important for people to have a good relation with their medical providers. That could be a physician, a nurse practitioner, a nurse, or someone. We know there's clear data that people that can relate to their medical providers or the medical providers show concern for them, then you have better compliance with the results. And so part of what we do is also make sure that we train a diversified workforce so that the workforce of healthcare professionals reflects the people that we see in the community. So that's another very important point. It's important to have compassionate medical providers that understand and can relate to the people that they see, as well as people understanding that healthcare is important, community is important. So I agree 100% with that.
I'd just like to share this and ask you the question here on Health IQ. Advocacy for yourself. Your blood pressure isn't quite getting under control. How do you ask your professional doctor for a reference for a specialist or someone who could help to see if there are other issues that could be causing that high blood pressure or uncontrollable blood pressure?
That's a great question. So at the NINDS, we have a campaign. The campaign is geared to African-American men 28 to 45. It's called Mind Your Risks. You can go to www.mindyourrisk.nih.gov. That's MINDYOURISK.nih.gov, spelled it out. And you can get more information about that. On the website, we actually have questions for people to take to their medical doctor, because that's important and you can ask. But having someone that you can talk to and you can ask questions and feel that they actually hear your questions. We know that particularly African-American women, sometimes the doctors don't listen to the questions, or sometimes people don't speak the language, or the doctor doesn't understand how things are expressed. And so that's important. So I often say that if you go to the emergency room, definitely, but even going to the medical doctor, it's good to take someone else with you who can actually hear, can maybe ask a question a different way for you, and to try to bridge that communication gap. So it's important to have an advocate, someone who can understand different communication styles and speak for you. So I think that that's very important.
I think when you talk about risk, we're not necessarily considering uncontrollable blood pressure or risk. What can we do as a community to change the fabric? Who else should be speaking out as it relates to the risk? I mean, is it, you tell me. I think who else should be sharing numbers and the facts and understand that there's a risk campaign going on for Black men right now to save Black fathers?
Well, I think we all should be a voice. I think anyone that's hearing this message should be a voice. You mentioned earlier, I think faith-based organizations are very important. We currently completing a strategic planning process for health equity at the NINDS. And one of the clear points that we take away from that process is that it's important to engage the community early in all processes in order to disseminate information. Large academic centers, community-based, federally qualified health centers, medical offices, paramedics, EMS offices really need to be engaged in their communities in order to disseminate health information. People should see their medical providers as being accessible. If not, then that creates a big barrier to health. Churches, fraternities, sororities, I'm a member of a fraternity myself, all of those kinds of agencies are important, as well as communication channels like this one is very important to get the information out.
I thank you for that, but I want to talk about predeterminants of health. We literally know that during COVID-19, from the beginning to the end, we saw that there was a tragic ending to many prematurely, the lives and their they say it's predeterminants of health, but just really where are we in the health spectrum as it relates to predeterminants of health? um, if you could kind of share quickly, and I say that because I got another question. Don't want to forget it, y'all. But
Okay, well, yeah, a lot of we found with the COVID pandemic that a lot of people who had premorbid conditions, that they were at higher risk of having negative outcomes from the pandemic or from getting infected. And so a lot of those are related to being obese, being overweight. Being overweight and obese increases your chance of getting diabetes. It increases your chance of high blood pressure. It increases your chance of high cholesterol. And so those are things that put you at risk, those premorbid conditions. Also, if you smoke cigarettes, or if you live in certain environments where like in crowded areas and communities where the air is polluted and not clean, or the housing situation, or the environment around the housing situation is not clean, that predisposes you to bad air and lung disease. And so a lot of those premorbid conditions were there that put a lot of underserved populations at risk: African Americans, Native Americans, and Hispanics. But diabetes, hypertension, high cholesterol, all related to hypertension, not exercising, puts you at risk for heart disease, and it's sort of a spiral of the same thing.
well, I love that, but I would sit there and say, well, you can't give them a pass, because the one thing we don't want is death by fork. Like at the end of the day, death by fork might be, um, I'm not going to say it trumps exercise, because you've got to move the body. The body wants to move, which is the other beautiful thing. Now, how it moves might be a question. You may not have to box, you may not have to do yoga, but it definitely wants to be taken out for a stroll once or twice for a period of time where it can stretch, and I think even learning to stretch. But can we talk about the role that diet plays in really sabotaging your health, particularly in that group and time when you're watching your weight grow and blossom in that 28 to 44, you forget your high school weight and assume this new weight. What can you share with us about death by fork and how the role of food and our dietary decisions play a role?
No, I think diet and exercise are key. Really, your body is a machine and it needs energy to survive. And so, if you put more energy into it in the form of food and you don't use that energy, then it's going to be stored as fat, as excess energy. And that fat can create problems on your body. But between the two, diet and exercise, if I said one was more important, it would be the diet. Um, just having a healthy diet. And again, if you have 5 to 7 servings of fruits and vegetables a day, that's important because there's several studies that have shown globally that people that don't get vegetables into their diet have a higher risk of stroke and heart disease. But yeah, if you don't get that into your diet, or if you're eating the wrong foods, like a lot of salty foods, we know that increased salt in food, and sodium is in a lot of different foods. Sodium chloride is, or anything that says sodium in it is going to be what we call salt. That's going to raise your blood pressure. And that's in most foods that people like to eat, chips and fries and all those kinds of things, raises your blood pressure. The other foods, the fats and all that's in that, it's going to cause you to gain weight as well. But a lot of that, just by having a healthy diet, if you just have moderate exercise and a healthy diet, then that could actually lead to a better lifestyle than just eating whatever you want to and then trying to go to the gym 3 times a week. that you're still sort of chasing your tail and you're not going to catch up. You really have to have that diet in addition to the exercise in order to get the best benefit. but that's probably I'd say the greatest modifiable risk factor for decreasing your risk of having a stroke or heart attack or dementia later in life is having a nice, healthy diet full of fruits and vegetables. I'd say moderate some of those other things, and then trying to exercise at least 20 to 30 minutes 3 times a week at a minimum.
And from a health IQ standpoint here, rolling out, 3 times is probably a failing grade because you want to love yourself just a little bit more. I think all of us need to figure out, and I think that I'm just sharing with you that here at Health IQ, 10,000 steps. Make that the minimum goal. You should have some idea of how many miles you walk or run per month and set active goals. It's our vision here at Health IQ for you to hear the voice of trusted Black physicians when possible. Others are welcome, but clearly we have those who are been steeped from Fisk to Meharry to Harvard, for those of you that need new and more validation. But clearly, for me, I want us to know that there are champions who are doing the research. And lastly, how important is it us for to participate in research studies?
I think it is extremely important too, because whatever medicine, whatever type of technical device that's being studied, if it doesn't have a diverse group of people participating in the study, then it impacts the results of the study. And so oftentimes there have been a lot of medications that have been tried or part of clinical trials, and they don't have a lot of diverse people in the study. And you now have to go back and retest that in different populations to see if the results are still valid. And so we consider that research that's not rigorous when you don't have a population that's tested that's at risk for the disease. And so we talk about that a lot. But the flip side, I mentioned early the community engagement. In order for people to participate in clinical trials, they have to have that trust in the healthcare establishment. And so I really think that the healthcare establishment has to do a better job at getting that trust built so that people can participate. But it's been clear that participating in a clinical trial oftentimes does lead to better medical care because you do get that follow-up more frequently from your medical doctors and all. And so I definitely think there's a benefit to participation, but definitely, and it's harmful to the research if it's not diverse, but researchers have to do a better job at engaging the community, explaining what the research is about, helping people to understand the benefit of the research, and then also reporting back the results of the research study or the research findings. That's another piece. We talked about disseminating information. Like what I'm doing today, I'm talking about one of our studies that showed that people that have their blood pressure controlled less than 120/80 have a lower chance of having cognitive impairment and stroke and heart attack later in life. And so we have to get that to people. And that was based upon people that participated in a clinical trial, a study. So it's very important to have diverse people in clinical trials.
Well, it's been a blast having you here on Health IQ. You've given us a huge swatch. Now, if you would give us our marching orders, what 3 things do you want us to do now that we've listened, heard from you? What are the 3 things that you want us to do today as it relates to our blood pressure, our predeterminants of health, and our ability to help someone who might not know that their blood pressure is out of control, that is in that age group, 28 to 45?
Okay, I would say number one, to increase your physical activity. As I said, a minimum is 3 times a week, but I agree with you as well. I think you eat every day, you wake up every day, so you should do some exercise every day and focused exercise. So I'd say to walk at least or do something vigorous 30 minutes a day, every day. If you can do that, that would be one thing. And that really decreases your chance of having some negative health outcome, and it improves your health. It's good for your mental health, well-being as well. So that's number one. Exercise, do some exercise every day, and walking could be that exercise. Number two, improve our diet. Be very mindful of what we put in our mouths and what we eat. Try to get more fruits and vegetables, and they can be varied. Look at the color, just make something and just mix it up, the different colors in the food that you eat every day. So better diet is number two. And number three, I'd say to take charge of your health. Know your numbers, know your blood pressure, know what it is, know your blood sugar and your cholesterol, and then ask those questions of your doctor. What do I need to do to improve this? Read more, and then tell somebody else what you've read. Talk to someone else at your church, your fraternity, sorority, community group. Talk to them about it. So those are the three things I would say: exercise, better diet, and take charge of your health.
Well, you heard it first: exercise, diet, and that means that have more colorful plates. If your plate looks gray, brown, charcoal, you might want to add color to your palette on your plate. The other thing is increase your relationship to how vegetables taste fresh, uncooked, and have at least 5 to 7 favorite fruits and vegetables. And they never did some of these cliches. An apple a day could possibly keep the doctor away. It is an example of a very affordable fruit, one that's easy for children to get involved and acclimated to. It travels well, so you can take it to work. You can slice it up. You can kind of dress it up if that's what you need. There are better things than caramel to put on an apple. Cinnamon and other types of spices go really well without sugar. The cinnamon can add it. Just think of other things that will allow you to mix and match. Berries and avocados go well together. Take out timetables that society has given us as when we should eat things. Understand that you can have a bowl of kale or greens with quinoa in the morning. You can start your day with vegetables and fruit. You do not have to start your day with pancakes. So know that dispelling past eating habits and growing and learning and sharing community forums like this with geniuses and giants like Dr. Richard Benson here on Health IQ. I'm Munson Steed. I'd like to say thank you so much, Dr. Benson, for giving us your time, your intellect, and your passion for healing and helping our community here on Health IQ.
Thank you, Mr. Steed. It was my